In this video, we'll discuss about norovirus. Norovirus is a virus in the viral family Calciviridae. These are small non-enveloped RNA virus. These are actually 7 geno group of virus, but all of them have same symptoms. So the norovirus cause an acute viral gastroenteritis. Acute viral gastroenteritis. So important is it is acute, it is viral, it is gastroenteritis. So it meaning inflammation. So inflammation of gastrointestinal system. The name norovirus is derived from the place of its first outbreak. In the place was actually Norwalk, Ohio, United States in the year of 1968. So the name derived from first outbreak, the place Norwalk, Ohio, United States in the year of 1968. So the norovirus is often called Norwalk virus. Because of this reason, the norovirus is more likely to occur in winter month, most likely due to individual being inside more often in close contact. The virus can spread more easily, so it is also known as winter vomiting disease. So it is also called as winter vomiting disease. How is the norovirus transmitted? It is transmitted through fecal-oral route. So if we see an individual who has the norovirus with a similar illness, because those same member can easily pass it along to others through the fecal oral route. How does this happen? What happen is an infected individual can essentially become contaminated on their hands that can touch different objects like homids, which are the object like furnitures, can come from contaminated water source. So if feces from an infected individual it's into water supply, it can lead to contaminated water. Individual drinking water, the individuals drinking that water can become infected. Related to this is also sources, homids, contaminated water, food, especially leafy greens. Contaminated food supplies. So leafy greens. So, contaminated water is getting into leafy greens. If those greens are not washed properly, we can get the virus on those food, and it is very virulent. It is only required very small amount of virus to causes an infection, usually less than 100 viral particles. So even a small amount of virus can lead to an infection. Norovirus is shed in the stool from infected individuals. Norovirus is shed in stool from infected individual. That is how it is transmitted. So again it is shed in the stool and it is picked up in other places. An individual who perhaps has not washed their hand properly, you can touch object and contaminate those object and or can get into water or food. What is the really challenging about that norovirus? It can be said in the stool of an individual for approximately 4 weeks and even month in some patient, especially patient with immunocompromised. So even after individual has gotten better, they have resolved the infection, they can still be settling the virus for weeks. But the good news is that transmission of norovirus is more likely to happen if a patient is symptomatic compared to if the patient they are asymptomatic, but it can still happen if they are asymptomatic. What really challenging about the norovirus is that it is very stable in environment. It is very stable in environment. So because of this, we have special way to deal with this virus. The incubation period is roughly 24 to 48 hours. So it takes about 24 to 48 hours after become infected with the norovirus to actually start showing symptoms. So incubation period roughly 24 to 48 hours. How does the norovirus actually infected and causes illness? So what the norovirus that it affect, first it will affect gastrointestinal system. So the stomach and intestine, what it does to the stomach is that decrease gastric uh, emptying, and it is hypothesized that this is actually the reason why the norovirus causes nausea, vomiting. The norovirus has also shown to cause lesion in the jejunum, which is the uh, part of small intestines. In the norovirus has also been shown to cause malabsorption by affecting intestine mucosa, and what it does, it reduce the activity of enzyme like two enzyme like triglyceride and alkaline phosphatase, and it also inhibit the absorption of fat. So this is how the norovirus likely causing diarrhea. So again the norovirus leading to decreased gastric emptying, jejunum lesion, and persist enzyme activity, triglycerides and alkaline phosphatase, as well as decreased absorption of fat leading to diarrhea. So after incubation period. So this norovirus directly it will affected that gastrointestinal system. So stomach and intestine, stomach decreasing gastric emptying, then it hypothesized actual reason norovirus is causing nausea and vomiting. Then it will affected jejunum. So it causes malabsorptions by affecting intestinal mucosa. So it reduce the activity of two enzymes, triglyceride and alkaline phosphatase enzyme. So it will also inhibit that absorption of fat. So it causes diarrhea, vomiting, nausea, diarrhea, all the symptoms it will cause. So what are the other symptoms? Abdominal pain, which is described as cramping in nature, and then nausea, vomiting is non-bloody and non-bilious. Then watery diarrhea, that one also non-bloody, as well as it described as moderate diarrhea. It does not excessive like some other gastrointestinal condition. So what are the other symptoms? Abdominal pain, nausea, vomiting, non-bloody and non-fleas, watery diarrhea. That one also non-bloody. Then, but you see 4 to 8 bowel movement per day. But what do see with the norovirus, and what is the key? The norovirus is that nausea, vomiting occur more often than diarrhea. More often than diarrhea. So these are the other virus that can causes an acute viral gastroenteritis. But if you see an individual with more vomiting than they are having diarrhea, it is more likely norovirus causing the infection, and fever does not always happen. How do we diagnose and how do we treat the norovirus? When we were diagnosis this infection, when we were looking at laboratory investigation, we often see a normal leukocytes count, but in some cases it can be mildly elevated. And this diagnosis is a clinical one. So we see a patient there where have some symptoms we talked about before. We see that there have more vomiting than diarrhea. So it is more likely to be norovirus causing gastroenteritis, and the symptoms resolved in 42 to 72 hours. Clinical diagnosis, in some cases they may also do real-time qPCR, specific looking for the sources of an epidemic of the norovirus. So they want to make sure that cases are actually the norovirus. So we use real-time qPCR and detect the viral genetics of that norovirus. Treatment, it is a self-limited infection. The symptoms resolve spontaneously, so treatment is supportive. Use specific here not any specific diet, but we can use that broad diet. B stand for banana, R stand for rice, A stand for apple sauce, and T stand for toast. Then probiotic to use zinc. Then specific method to prevent the noroviral infections, hand washing with soap and water. No vaccines available currently. So this is all about norovirus.